let's talk about like your statin medications for your cholesterol, because the biggest thing there is your CoQ10. And so you may have heard about this. And the function of CoQ10, it's a powerful antioxidant, right? And it's synthesized in the body and contained in your cell membranes there. And it's also essential for your energy production and pH regulation. And so what causes the deficiencies, can be the medications. It's well documented that CoQ10 is a deficiency in statin medications as well. So a lot of times when you're getting put on that medication, you're also being told to supplement with CoQ10. The deficiencies can also occur, on anti-diabetic medications as well. So that's your sulfonylureas and beta blockers can also. So you're looking at, that's probably the biggest one for what many people are on who have P.A.D and coronary artery. Low levels of this can basically aggravate oxidative stress. It can cause diabetes, cancers, congestive heart failure, arrhythmias. You can notice it in the mouth, so gingivitis, and some neurologic conditions as well. And so when we look at CoQ10, your main food sources, again, are the meats and poultries and fish. Your soybean can be that. Nuts and whole grains can also have really good CoQ10 in them as well. You can get moderate sources of CoQ10 through fruits and vegetables, eggs and dairy. So it's a really important piece to that. You can do a serum lab draw and look at CoQ10 numbers as well. But I will say if on any of those medications, you're probably getting a deficiency in it, even with food. So
it's interesting because I didn't know that you could measure CoQ10 levels until my dad and my mom ended up going and getting advanced blood work through their functional medicine practitioner. Is CoQ10, as far as you know, available under insurance for most people? Is this something that
so
standard? Can people request it?
A lot of times with like a diagnosis of peripheral arterial, coronary artery, hypercholesterolemia, you can do some of these specific testing. It's really hard to know what insurances will and won't pay for, but you can always call ahead of time to your insurance and just question, if I'm in network at a lab, how is this covered? There's always the big thing about deductibles too, like have you met a deductible? And so that kind of plays into what the cost of things are for many people. Boston Heart is a lab that does this whole, they do a whole panel for cardiovascular. I really like that lab. It's very comprehensive. They'll do homocysteine. So I've done CoQ10 levels and homocysteine levels on many of my patients without them having to pay extra. It kind of fell in their routine, what their labs were covered. So
I love that you mentioned Boston Heart Diagnostics here in the US. That's exactly the blood work that both my mom and my dad went through, and they send you an actual full booklet that literally paints the picture of exactly what every single result means. And they do it in layman's terms, which is amazing. And that's what makes me so just concerned that there are doctors out there that will refuse to do Boston Heart Diagnostics and won't sign on, even though it's free for doctors to sign on to offer Boston Heart Diagnostics lab work, which is the most advanced blood work I think that you can get for cardiovascular diseases and vascular diseases. It's really comprehensive, and Medicare covered it for my dad with a copay. So that was pretty amazing. And they have special labs that actually offer it. But the doctor actually, one of the doctors said to my dad, no, we can't offer it any longer at our hospital because the doctors don't know how to read the results or what they mean. That's disconcerting to me, that here is advanced blood work that is available and doctors are not taking the time to learn more about what this blood work potentially means. They're just waiting for this grander evidence to come out about that. But why don't these doctors become a part of the process, a part of the journey, a part of practicing medicine to help advance the understanding of the results of this blood work, this newer blood work, this more comprehensive blood work, so that they can offer it to the patients and customize medicine and customize the supplementation along with this medicine.
Exactly. Boston Heart, the way they present it to you as the patient and what you get out of that is so powerful, because when you get your routine labs, you're just told if they're normal or if they're abnormal, right? You get a little bit of that, but it in detail tells what's going on. If you can find a provider that does that, phenomenal. Have it done at least once, know your body really well. But we're getting a trend towards more personalized medicine. We are, but we're not there yet. You're right. There's a huge gap in what we should be doing and what we are doing.
I'm curious. We have Kim who wants to go back to the CoQ10. She's asking, should you get the ubiquinol version?
Oh, yes, good question.
I was just told
There
that
she is.
basically it absorbed better.
Yeah, and it's very helpful for improving heart health, blood sugars, and managing blood pressure, and people with diabetes. So it's just a better absorbable form of it, which sometimes can be hard to find in just the regular world of things. What's the best absorbable? You walk into a store and you see all the supplements, and it's like, where'd I go from here? So sometimes you can ask a pharmacist for their help. I had a patient recently go up to the pharmacist and say, show me which magnesium. And she was like, not good, okay, best to the patient. So getting some guidance on that. But yes, the ubiquinol is a better absorbed